Well, in the previous segment, we showed you how to defend yourself if you ever become a victim of a crime. These events can often lead to post-traumatic stress disorder. So how do you know if you're suffering from PTSD? Joining me now with some answers is Dr. Bradley Wajda with Esano Incorporated. Dr. Wajda, good to see you again.
Good morning.
First of all, when did the medical community even begin to recognize post-traumatic stress disorder?
Well, it wasn't officially recognized by the American Psychiatric Association until 1980. Of course, there's many descriptions of post-traumatic stress symptoms that span centuries. In the First World War, it was called being shell-shocked. Even back in the Civil War, it was called soldier's heart.
Okay. So it's been around for centuries, it's just not recognized so much by the medical community.
Right.
Okay,
right.
Up until pretty recently. Now, a lot of people associate post-traumatic stress disorder basically with just soldiers coming home from war.
Right.
Is that usually the case?
Well, actually, it depends on your setting. In the community, most of the cases of post-traumatic stress I see are victims of abuse. Childhood sexual abuse, can be domestic violence. Occasionally, I mean, certainly it affects crime victims, but there are just so many people out there suffering from PTSD as a result of abuse.
For children, so can suffer from this as well.
Oh,
obviously.
absolutely.
Okay.
Absolutely.
What are some of the symptoms? I mean, well, first of all, let me ask you there. Are there exact causes? Can anyone can suffer from this then? Anyone that's undergone or gone through some sort of traumatic event, like
Right.
war, an attack, abuse?
Well, technically, the definition is you have to have been threatened with serious injury or death, although a lot of that's in the perception of the person it's occurring to. So, yeah, and there's no reason given or discovered as to why it affects some people and not others. You know, it will span all age groups. It is twice as likely in women as men. But
and that brings us to some statistics. It says in the United States, 7 to 8% of people will develop PTSD in their lifetime. 5 million people suffer from PTSD at any one time. And as you mentioned, women are twice as likely as men to develop PTSD. Do we know why? Maybe because we're a bit more sensitive?
Again, good question that I don't have an answer to, and I haven't found an answer to. But again, I think a lot of it is that perception. I've even worked with people who were emergency services personnel, and you'll work with people that have done it for 20 years. They've seen car accidents, serious injury and death. They don't ever develop post-traumatic stress. You'll have other people who will have one incident that causes a lifetime of post-traumatic stress.
What are some of the symptoms? And I know through your notes that they fall into 3 main categories. The first one being re-experiencing.
Right. Well, you've heard the term flashbacks. That's where you're actually feeling like you're re-experiencing the trauma as it's happening now. In other words, you're really unaware of the surroundings. You think you're back in the trauma. That doesn't happen so often. Most of the re-experiencing, those are just recurrent intrusive thoughts or nightmares.
Avoidance.
You'll have various triggers that will remind you of the trauma. It can be watching a movie and seeing, if you were in a car accident, you see a car accident, or you have even difficulty driving or traveling in a car. You can have a really strong emotional reaction to that, but you'll also avoid it. And so you'll see a lot of avoidance behavior.
Hyperarousal.
That includes being hypervigilant or an exaggerated startle. A lot of it depends on the type of trauma. And anger is included in that hyperarousal, and that's there frequently in abuse victims.
And you mean when people lash out at others or
very inappropriate anger?
Oh, okay.
Yeah, very inappropriate anger.
Treatment. Let's talk about treatment. What are some of the services? What kind of treatment is out there? I mean, does this type of illness require medication?
Medication is supportive.
Okay.
It is used to decrease the intensity of the symptoms. Therapy is the cornerstone of treatment. There's also techniques, whether it's hypnosis or something called eye movement desensitization and reprocessing, reprogramming.
What in the world is that?
That's a technique that was actually developed by a female psychologist who was a victim of rape.
Okay.
And she discovered that every time she had that re-experiencing, she would have similar eye movements that were tied to her memories. And so that was a technique that was developed to try to treat the traumatic memories and therefore the intensity and the pain and the symptoms that become post-traumatic stress. And there are various therapists out in the community certified to do that.
Yeah. And we have about a minute left, and I want to get to all your locations and your number, but really quickly, because a lot of the times our children who are abused, parents obviously don't realize what may be going on. What kind of symptoms should we look for in a child?
Well, children are very prone to act out. You know, they're not nearly as verbal about what they're thinking, feeling. So oftentimes post-traumatic stress in children is exhibited strictly by behavior. Okay. These kids are not going to be telling you that they have a sense of a foreshortened future, or they're worried about being a victim of abuse again. They will oftentimes act out the trauma or act out on the anger.
So watch out for those symptoms. 999-9514 is the number to your new office, is that right? Or is that the Herndon office?
Well, the Herndon office is our new office, which
there
is Fruit and Herndon.
Fruit and Herndon.
Yeah. Actually, we're in the process of getting an additional number, but the 999-9514 is always good.
Well, if you have any questions for Dr. Wajda, please give him a call. There's 3 locations, 2 in Fresno and 1 in Merced off Olive Avenue, Suite 105. Thank you so much, and we will see you again next week, Dr. Wajda, with another very interesting topic.
Thank you.
All right, no problem. We'll be right back, everybody.